part of our daily lives. It's an integral part of the human experience. Music makes us sing, dance, cry, laugh. Music makes us feel alive. But there is much more to the benefits of music than just a quick boost for your mood. For centuries, cultures around the world have been using music for emotional healing, changing behavior, and communicating. Studies have shown that music can help people manage stress, promote wellness, enhance memory, improve communication, aid physical rehabilitation, reduce pain, and give people a way to express their feelings. And this is because music directly impacts the areas of the brain that are most closely associated with emotion. This is why music has been recognized and organized as an effective form of clinical and evidence-based therapy. According to the American Music Therapy Association, music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. But what does that mean exactly? To help us understand what music therapy is, I have invited 3 amazing music therapists who will be answering all of our questions.
Hi, my name is Tara Brinkman, and I'm a board-certified music therapist.
Hi, my name is Steven Franco, and I am a music therapist.
Hi, my name is Nicole Cassingham, and I'm a board-certified music therapist.
But before they answer all of our questions, let's get to know them a little bit and find out what inspired them to become music therapists.
When I was younger, I had a hard situation happen to me, and I started making up songs. I had this little Fisher-Price cassette recorder back in the days of cassette players, and I heard songs on the radio and took their tunes, their melodies, and made them into songs about how I was feeling. And when I was in high school, I was deciding what college I wanted to go to and what I wanted to major in, and I really had no idea. At that time, they sent us brochures, like little magazines basically of each college to see if you were interested in the college. And I was flipping through some of them, and I came across a major at a college that was called music therapy. And I was kind of surprised because I had never heard of it before. I started to research it online, and it seemed like something that was interesting to me. So when I did a couple tours of colleges that interested me, I got to meet a music therapist, and it was really cool talking to her and hearing about how music could really help people. And I knew that that's what I wanted to major in for college.
My journey in music therapy started when I was in undergrad. I was doing a bachelor degree in classical guitar performance in the Conservatory of Music in Puerto Rico. Also, I did a certificate in music education. At that moment, a friend gave me an article talking about music therapy for people with autism spectrum disorder. That article gave me so many opportunities and opened so many ideas in my head about how we can use music as therapy. After that article, I read a book about music therapy introduction. They gave me so many other possibilities and how music is used in so many settings. So I went ahead and applied for a master in music therapy in a university in Kansas City, Missouri. I completed that, and I went ahead and started working in a mental health facility. I really enjoy my work as a music therapist.
My journey to music therapy begins probably when I was a child. If I could look back, I could probably say that I engaged in flow state when I was young, listening to my records and dancing and singing along to them for hours at a time. I was involved in music, going through school, singing competitively, and it was always a big part of my life. And I always felt that I could express myself when I was in music. Later, I joined some bands in college and felt a strong sense of cohesion and a lot of development through the musical experience that I had through those years. And then later, I worked with children with autism as a behavior therapist, and then kind of blended my two passions together and attended music therapy school. I did first learn about music therapy in university and had written a report on it. And at the time, I remember thinking, this is exactly the thing that I want to do. But at that time, I didn't pursue it after I graduated, and then ended up going back and achieving that goal.
Music therapy uses music to work on non-music goals. So some of those goals can be things like social skills, communication, leadership skills, managing emotions like stress, frustration, anger, things like improving concentration and memory, and just increasing our overall health and well-being. So a board-certified music therapist would do a music therapy session or group, and some of the interventions or the ways we use music are things like playing instruments, singing together, looking at words to songs and talking about them and how we can apply them to our lives, and even writing songs.
Research has demonstrated that people who receive music therapy in a hospital setting require less pain medication and actually exit the hospital sooner than people who do not receive music therapy. And that's for general treatment in the hospital and also in the NICU. Music is used to help infants with their sucking response and allows them to eat regularly and build their weight so they're able to be healthy and leave the hospital. In respect to speech and people who have strokes or managing individuals with Alzheimer's, music therapy is very useful in helping people stimulate their brain to support cognitive thinking, improving behavior, and improving their ability to communicate with others.
Anyone can benefit from music therapy. It's true, we can help anyone. So we say a lot of times that music therapists work from birth to death. And what we mean by that is that we can help people, babies in the NICU, babies who are born, then we can help people in schools, we can help people as they grow up if they experience the death of a family member or a friend. We can work in hospice settings, we can work in prisons, we can work in private practice, which would help whoever can come to see us. We can work in regular hospitals, and we can work in really any setting that you can think of, because we can use music to work on any goal that someone needs help with.
As a music therapist, I get this question a lot. What kind of music do you play in music therapy? So, as a music therapist, for us, client preferred music is the best. So what the client wants to listen to and they prefer to listen to, that's what we use. So, as a music therapist, you need to be ready to play different genres of music. It could be country, pop, rap, reggae, hip-hop. It could be corridos, rancheros, boleros, salsa, merengue. It could be any genre or style of music. Why do we do that? Because we want the patients to be engaged in music, and the more they are engaged, the better they will do in therapy.
I've had a lot of people tell me, oh, I do my own music therapy. I listen to the radio in the car, or I play songs on my guitar. I'm a music therapist too. And yes, that's using music in a therapeutic way, but it isn't the same as music therapy. So the difference is that in music therapy, we have a trained board-certified music therapist who is providing the interventions. which we talked about as the ways we use music to work on goals. So as a music therapist, I would come into a session with an idea of a goal we're working on and specific objectives, what we're doing, and I would tailor the music experiences to work toward that goal. And it's important to have a music therapist help with the music therapy because it's an extra set of eyes and ears that can help us decide where we're at, how we're feeling, and learn how to express that, and really work on the goals to improve ourselves.
This is a really important question. The misconceptions of music therapists are quite broad. Some include that we are only for fun and that we're for purposes of entertainment. That maybe music therapy is a new age type of thing or that it's new, but really it's been around since 1940, just after World War II. And the first university started a music therapy program in 1950. Other misconceptions involve people thinking that you have to be a musician to benefit from music therapy, and that music therapists only play recorded music for a patient and it's all about just listening to music and not really dealing with or managing any other kind of serious topic or issue. Some people think that music therapists only work in medical hospitals, or maybe music therapy is only for children. Sometimes people think music therapists are teaching music to their clients, and other people think that any musician can be a music therapist.
So music therapy can be provided in a group setting or individually with a one-on-one setting. And how the session is structured really depends on who's receiving the music therapy and what the goals are for that session. So typically we would have something like a summary of what we did the week before or the last session, or some sort of introduction. That can be like a hello song, talking about how we're feeling, playing how we're feeling on an instrument. And then we would do our interventions, and that's where we would do maybe music listening, writing songs together, playing instruments, improvising on the instruments, talking about different songs, etc. And then we would do some sort of closing. And that really depends on how the session is structured. So it could be something like we could write a song together at the end, or we could close with one of our favorite songs, or we can play instruments to end the session, or we can do just a summary of what we did that day and a plan for the next week or the next time before we see each other next. So the sessions are really structured based on the people in the group or the person in the individual session and what they're working on in music therapy.
So as with traditional therapies, a client might see a music therapist once a week or once a month. Really depends on the client's need and what you're working on. In places like hospitals or hospice settings, the NICU or palliative or cancer care, it really is dependent on the patient need.
Music therapy has different health benefits. Let's think about a hospital. Before a surgery, a patient might feel stress. So a music therapist might bring different music therapy interventions to manage that stress. Examples will be sing-alongs and playing live music with instruments with the patient. After the surgery, the music therapist can help the patient relieve pain with music relaxation and music listening, providing a list of songs that might help the patient listen when he's feeling pain. Another example will be a music therapist working in a school. Sometimes it's hard to express our emotions and to manage our emotions. So a music therapist can use different music therapy interventions to help us with that. Different interventions like writing songs, Playing live music might help with that. When we write songs, it's easier to express our emotions. Also, when we're playing drums in a group setting, we can see other people express their emotions and we can express our own. Another example is to listen to different music that we like and trying to figure out what the artist is trying to express.
If you're interested in becoming a music therapist, the first step is to learn an instrument or start singing. All music therapists, when we go to school, have to have a main instrument. So, like I said, that could be voice, that could be guitar, piano, percussion, tuba, violin, cello, etc. It could be any instrument. And when you're learning an instrument, you already learn a little bit about the music theory, how to read music, and things like that that will help you in school. Once you have your instrument, you would apply to the school that has music therapy program. So you would apply to the school and either do an audition in person or send a video or something like that. And they just need to see where you're at with your instrument and see if they're going to accept you into their program. Once you go to the school, you take your classes like music theory, music therapy classes, orchestration, sight singing, music history, and then your regular general education classes. So you finish your degree program, and in that you have practicum classes. So those practicum classes are where you get to practice doing the work of a music therapist. So when I went to school, I had a music therapist who was supervising me at those sites. So I worked in a kindergarten classroom, and I got to work with some kids who had special needs. And I also got to work in a psychiatric facility. So it really depends on your school what kind of settings or options for you. But you do those sessions and you work with your professor and with other music therapists and come up with your lesson plans, and you get to practice doing the music therapy interventions. And then after school, you apply for a 6-month internship. So it's a certain number of hours, I think 1,040, right now, but it's about 6 months or so of an internship. And that's when you get to work directly with a music therapist and practice using your skills. You practice documenting, writing your session plans, doing notes, working with patients or clients in treatment team settings, etc. It really depends on where you do your internship. But you get to basically practice being a music therapist and learning all of the skills that you would need. And then you can take the board certification exam. So you have to answer questions about things that you learned in school. And once you pass that exam, you can work as a board certified music therapist. So it's pretty neat. I did a bachelor's program, so I went straight from high school to college and got my degree in music therapy, and then did my board certification exam and have been working as a music therapist ever since. Other people have a bachelor's degree in something else and then find out about music therapy, or then decide they want to get into music therapy, and they can do what we call a master's equivalency program. So they go to school and they learn a lot of the same things I learned as a bachelor's degree, but also the next level. So they get deeper into the psychology, therapy side of it, and have to do a thesis a lot of times, and then they get their master's degree in music therapy and are eligible to take that board certification exam. So there are a couple options of ways you can go to get there. But it's a really great field, and feel free to reach out and talk to any music therapist that you can find. And if you have more questions about it, we're always happy to answer questions.
Thank you, Tara, Nicole, and Steven for sharing with us what music therapy is. If you have any other questions, just comment below or visit the American Music Therapy Association website for more information. Thank you for watching, and stay tuned for more educational videos like this.